Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are sitting down with Dr. Tom Weida, a Chief Medical Officer with the University Medical Center. And today we're going to talk about COVID-19 and the years that have spanned in between. Thanks for joining us today, Dr. Weida. What can you tell me about COVID-19 and how it's been different over these last 5 years?
Well, certainly at the beginning in COVID, very severe illnesses. People would get a lot of lung problems, this brain fog, and a lot of them ended up in the hospital. And unfortunately, a lot of patients ended up dying because of COVID. It was very severe. But since then, either people have been exposed to COVID or they've been vaccinated against COVID. And so it seems to be a little bit milder right now. However, still highly infectious, and it mutates. And so the vaccine that you might have had in the beginning may not be as effective as the newer versions of vaccine, because there are tons and tons of mutations that COVID has gone through, and what makes it particularly difficult to prevent and or to treat.
What are the most recent mutations?
Well, the most recent mutation is called Nimbus. And it basically, right now, it's about 43% of the cases. And what's different about this one is that it usually starts with a very severe sore throat. People say it's like razor blades for a few days, and then you get the rest of the symptoms. A lot of times with COVID, you have loss of taste or smell, which is, again, has been another unique feature of this virus. But the most recent version tends to have that really severe sore throat for a couple days.
Yeah. So what are some of the changes people need to do now versus then?
Well, certainly if you haven't had a COVID vaccination ever, it certainly makes sense to get one. Now, right now, although there's been a slight peak of COVID here through the summer, not as bad as last year. But they are feeling that during the respiratory season, here in the winter, when people get together and get to spread all their germs, that COVID will be on the rise. Now, we still have the COVID vaccine from the 24 to 25 season. The new one has not been released yet. They anticipate that coming out in the fall, which has a little bit different formulation that hopefully will be more protective against this current strain.
Has the strain changed by age? Because I remember when COVID-19 came out, it most affected the older population.
Well, COVID still will affect the older population preferentially, and that's because their immune system may be a little bit slower, and certainly anybody who has chronic illnesses, chronic respiratory illnesses, heart disease, they're going to be much more prone to the COVID effects and COVID infections. So the elderly certainly are very much more prone. Now, the recent recommendations on the vaccine have basically said that you don't necessarily need to immunize children or pregnant women. Now, some physicians disagree with that because, again, COVID can affect everybody, but right now this is what the CDC has recommended. However, they are recommending COVID vaccine after the age of 18.
So what about boosters? Are those and also another alternative people can do or get to help them with COVID?
Well, the COVID vaccine, like I may have said, is that there's a 24-25 formulation, which is still available that people can get. I'd recommend if people have never had a vaccine, they get that one. Now, there's a booster that's going to be coming out, or another annual vaccine actually, coming out for the 25-26 season. And I would recommend that folks get that. Now, if you've just gotten the 24-25 vaccine, you don't want to get another one within like 6 weeks or 3 months, so I'd hold off. But if it was last season that you got a COVID vaccine, I would recommend you get this season's vaccine when it is released, which is hopefully going to be in the fall. So that's what I would recommend. Now, a lot of individuals feel, well, I don't need to get a vaccine. I can take ivermectin, hydrochloroquine, and it's been proven time and time again, multiple studies, this does not work and could potentially be hazardous. And it be hazardous because it prevents you from getting appropriate prevention or appropriate treatment, because there are treatments for COVID if given early, but they are not ivermectin and they're not hydrochloroquine.
Well, is there anything that I haven't asked that you would just like to add?
Well, COVID still can be serious, still deaths from COVID, so important to protect yourself. Again, like most respiratory viruses, you want to, while you have a fever, isolate, stay home, don't go to work, don't spread it to your coworkers. Stay home while you have a fever. Stay home until you've been fever-free for 24 hours without fever-reducing medications. And then when you go back, wear a mask for 5 days or separate at least 6 feet from people so you don't spread it to your coworkers. So, be kind to your coworkers, even the ones you don't like.
Well, thank you so much for joining us today.
Thank you for having me.